Hello, thank you for joining me today for another important COVID-19 discussion. I'm Therese, Executive Vice President and Chief Operating Officer at Tower Health. I'm looking forward to today's discussion. This information will be helpful to our community. Today, I have the pleasure of speaking with Stephanie Lee, CEO of Tower Behavioral Health, and Dr. Eduardo Espiridion, who serves as the Chair of Psychiatry at Reading Hospital, Tower Health. Stephanie and Dr. Espiridion are going to help each of us learn more about how to prepare for the next phase of the COVID-19 pandemic. They will provide us a few tips as we start to re-enter social situations. Thank you both for being here today. I'm really looking forward to the discussion and what you have to offer for us.
Thank you so much for having us, Therese. It's great to be here today.
And thank you for having us today.
Our pleasure. With the increase in vaccinations and infections below the significant surge we saw in the winter months, we are entering a new phase of the pandemic. We know the virus is still circulating in our community. Individuals are getting sick and being hospitalized, but there's really a very strong desire to return to some normalcy. People are ready to once again be able to participate in activities they enjoyed prior to the pandemic. Dr. Espiridion, can you share some of the increased stressors individuals may be facing because of the pandemic?
Yeah, I would love to answer that. It is really tragic that the impact of the pandemic has really affected a lot of people. There have been losses of loved ones, losses of jobs, significant financial pressures, and the new virtual schooling is in place. There were a lot of loss of social interactions and engagements, which leads to increased isolations of different people, different backgrounds. They tend to have these feelings that just won't go away with the vaccination.
Thank you, Dr. Espiridion. The past year certainly has had a significant impact and presented many unique challenges for individuals. Given everything that we've all experienced, you both previously shared that some individuals may be anxious to safely re-enter into more normal activities. Stephanie, to prepare, you recommended performing a self-assessment. Can you explain that to our listeners?
Sure thing. Self-assessment is taking a close look inward at ourselves and identifying what healthy and unhealthy habits formed over the past year. We can use the assessment to decrease unhealthy habits such as excessive drinking, binge watching TV, etc., while increasing use of healthy habits such as spending time with family, exercising, reading, doing puzzles, and so on. Self-assessments increase our self-awareness, which helps us to make informed decisions about our behavior and what our priorities are.
That's great advice, Stephanie. As a result of pandemic, I began FaceTiming more with my grandsons and watching them cook, which was a lot of fun for both of us. So as we think about helping folks re-enter, can you give us some ideas on how to prep for re-entry?
Continue to follow the CDC guidelines. Unfortunately, the pandemic is still not over. Continue to wear a mask and avoid large gatherings in confined spaces. Consider outdoor activities such as meeting a friend for a walk or outdoor dining.
Those are great. In addition, you can also just take small steps to adjust. Don't take on too much too quickly or overcommit yourself. If you find yourself in a social situation where you may feel anxious or overwhelmed, remove yourself from the situation. Only participate in activities that feel safe for you and your family. Focus on and continue to practice the healthy hobbies developed during quarantine to manage your stress. Maintain and prioritize the traditions you created with your family during the pandemic. Many families have begun weekly movie or game nights, or similar to Therese, started fun activities from afar on FaceTime, such as cooking or doing games. So there's a lot of ways to continue to do that.
Those are all really great suggestions. Dr. Espiridion, is there anything else that you'd like to share with our listeners?
Be patient with each other. After a year of isolation, it will be more difficult for some to re-engage with more normal social interactions. We become conditioned to a new environment, and many will need time to readjust. If you go somewhere that is crowded, it is possible you might feel anxious and overwhelmed. So, do gradual small steps to re-entry, examples of which include walking in a park when you see other people and exercise helps naturally reduce anxiety.
Thank you so much. That's really very helpful. Stephanie, what are some of the signs that individuals may be anxious or overwhelmed as they re-enter?
So a big sign is panic attacks. Some other small behavior changes are changes in sleep patterns, increased or decreased consumption of food, changes in weight, avoidance of activities that you once enjoyed. And anxiety can often lead to unhealthy behaviors to avoid the feelings of stress and anxiety.
This is all really very helpful information, and I appreciate both of you taking the time to explain this to our listeners. We'd be remiss if we didn't recognize the lives lost to the pandemic. So many have lost family members or a friend. How can we help each other through this?
So we've never had to deal with loss on this scale. As a result of the pandemic, sadly, many haven't been able to grieve properly. Grief is unique. There is no wrong or right way to grieve. It typically comes in a wave-like pattern as you experience a range of emotions: sadness, loneliness, regret, anger, guilt. These tend to ease over time as people adapt to their changed circumstance. Some helpful ways that help to ease those feelings are to remember to keep daily routines as they provide structure to your day, to focus on self-care, to reach out for support. And some people have found that planning a post-COVID-19 memorial or service has been a helpful way to grieve.
Those are very important responses, and I perfectly agree with that. Unfortunately, grief is much harder when we can't be together. This is the situation during this pandemic, and unfortunately, this will be felt for years to come. In order to actually adjust and deal with this issue, try to reach out to those people who have lost a loved one. Give them a call, try to reach out. Those minimal interactions mean a lot for those who have lost someone they love dearly.
I appreciate you both speaking with me today. As we close, can you please share how individuals can connect with members of your team for additional information or to schedule an appointment?
Tower Behavioral Health is accepting new patients. We offer in-person and telehealth options for outpatient. You can contact 484-628-8070. If you or someone you know needs immediate help, please call 911 or our inpatient behavioral health service at Tower Behavioral Health, 484-659-2330, or Berks County Mental Health Crisis Intervention and Emergency Services Hotline at 877-236-4600, or text RUOK, letter R, letter U, letter O, letter K, to 484-816-7865 right away.
Dr. Espiridion, Stephanie, I can't thank you both enough for being here today. I appreciate you sharing this very important information for all of us. And for all of you listening, thank you for joining us today. Please take care of yourselves and be well.